Okay. Hello, my name is Victoria Holdeman, and this is Annie Parker, and she is going to be my patient today. And we're doing a full comprehensive physical assessment. And Annie, do I have your consent to perform this video recording today?
Yes.
Thank you. And I've already sanitized my hands, so we are ready to go. First thing before we do that, we're going to pan the room. And okay, you can see back there. Okay, and here. All right. So we're going to go ahead and get started. First, I'm going to look at her skin, and I'm noting for any lesions, lumps, bumps, redness, and symmetry. And then I'm going to check a few things throughout, and I'm going to go over all the cranial nerves we're checking, so we don't have to discuss them all the time. We're checking cranial nerve 1 for smell, cranial nerve 2, 4, and 6 for extraocular movements, and cranial nerve 5, facial sensation, cranial nerve 7, facial movement, and cranial nerve 8 for hearing, and cranial nerve 9 and 10 for swallowing, and gag reflex, cranial nerve 11 for shoulder and neck movement, and cranial nerve 12 for tongue movement. Okay, so we're going to feel her hair and make sure it's appropriate distribution, no lesions, and there's no lumps or bumps. Next, I'm going to check her how her facial movement is. So if you can close your eyes real tight and smile and puff your cheeks out. Perfect. Thank you. And next, we're going to check your eyes for reading, and that's using the Snellen chart. You can cover your left eye, and can you read the line that is closest?
LTFPH.
Or that you can read clearly. Perfect. And then the other eye.
LTFPH.
Okay, thank you. So she has no deficits in reading. Next, we're going to be checking, let's see, the consent for light accommodation and direct and consent. And I'm going to be looking in the pupils. Appropriate. Okay. And next we're going to be checking for convergence, and I'm looking for nystagmus and lid lag too. So I'm going to have you watch my finger and just move your eyes. Perfect. Okay. And then we're going to be checking with your eyes, and that into the chambers. I'm looking for red reflex, and make sure that's appropriate. And okay, so I'm going to, it's a little bright, so I'm checking for red reflex. I'm going to look straight ahead, okay? Okay, I'm going to come in, keep your eyes open, and there is the red reflex, okay. And then on the other eye, come in at the angle. Okay, and I see a red reflex there as well. Okay, next, we're going to be looking at, let's see, and I'm going to inspect your ears, your ear canals. And before I do that, we're going to make sure the ears are appropriate, clear, no redness, no swelling, both ears. Okay. And look inside your left ear first. And tympanic, I see your tympanic membrane, and it's clear, and the ear canal is clear. Tympanic membrane is appropriate. It's pearly white. And they're perfect. A little bit of cerumen, but other than that, they're clear. And I'll change this. Okay. Okay, so let's see. Oh, now I'm going to check for your hearing, excuse me, hearing both ears. And I'm going to whisper something and you have to repeat it. And this is whisper test.
Baseball.
Perfect. And this ear.
1, 2, 3.
Perfect. Okay. So that's intact. Now I'm going to look inside her nose, and I'm going to look at the nose itself too. Nose appropriate. And I'm going to look inside the nares. I'm going to have you tilt your head back a little bit. You can see me. And nose appropriate. Pink, no discharge. That's the left nares. Sinuses, same thing on the right. Okay, and there's no discharge, and it's pink. Okay. And let's see. I'm going to check your mouth and jaw too, and checking for inside your mouth, inspecting the gums, and they're pink, and teeth are appropriate and they're intact. We'll have you say ah too when we're doing this. Okay, so I'm going to look inside. You can open your mouth, say ah. Perfect. And then I'm going to have, let's see, I'm going to feel teeth. You don't have any problems with your teeth, right? Well, okay. And I'm going to, I don't know if I can do this, put this on. I'm going to hold your tongue. You can stick out your tongue. I'm going to move it. And it's midline, it's appropriate. And make sure there's no lesions, and there's no lesions, and its tongue is appropriate. Perfect. And checking the neck for symmetry and any lesions or anything. And any pulsations in the carotid artery. And I don't see any. Perfect. Okay. And then we're going to check your neck, your lymph nodes, and there's several. And I'll just tell you what they are before I feel them. So we're checking the preauricular, posterior auricular, occipital, submandibular, tonsillar, submental, superficial cervical, and supraclavicular. Okay. Feels appropriate. They're small. I can't even feel them. And I'm going to have to raise this up. And Annie, because of her religious beliefs, is not allowed to expose herself much. So that's why we're wearing the t-shirt, but I'm lifting it up as we do the assessment. And I'm feeling all the areas here for the lymph nodes. Okay. And okay. And feels appropriate. They're small. Okay. Next, we're gonna let's see. I'm going to, do the chin, the extension. So we're gonna turn your chin up and then down all the way and rotate your head side to side and ear to ear on each side. Perfect, thank you. And let's see. Now we're gonna check your anterior chest for your breathing rate and rhythm. And I'm gonna have you just lift your shirt so I can look at it closer. Okay. And it's appropriate. And the AP and lateral diaphragm diameter are appropriate in measurement. And I'm going to palpate the anterior chest for note any heaves, thrills, and I'll have to have you lift that up again. And I'm going to palpate here and here. I'm going to have to lift this up a little bit. Okay, I don't feel anything in there. Okay. And there. Okay. And I'm going to have you lower your shirt. Now we are going to, I'm going to inspect your chest wall. I already did that. Oh, I'm going to percuss, and I guess I could do that real quick. And then I'm going to listen to your heart. Okay, so I have to percuss your chest too as well. And that's doing this little tapping. Don't feel any fremitus. And okay. And we'll do this side. No fremitus. Perfect. Now I'm gonna have you keep that up. So I have to listen to your heart. And the heart sounds, listen to aortic, pulmonic, tricuspid, Erb's point, and mitral valve. And the S1 is usually louder than S2, except S2 is louder at the base, up towards top of the heart. Okay. I don't hear any heart murmurs. Heart sounds appropriate. S1, S2. Actually, I'm going to look this up so I can hear it better. Perfect. Okay. Okay, so next I'm going to listen to your chest. So I'm going to have you turn around and you'll be sitting. All right, now I got to lift up this shirt so we can get in here, okay? All right. Whoop. And we're going to listen to all faces here. Okay, you can just breathe normally. Okay, clear throughout, no adventitious sounds. Good. Good, and breathe normally, normally, and breathe normally. Thank you. Sounds so no adventitious sounds, and it's appropriate. Clear throughout the chest. Oh, and I forgot to mention on the heart, I would use the bell as well when I listen to the heart. Okay, so I'm going to inspect her upper extremities next. So I'm going to turn here. I'm looking at her hands. No clubbing, no cyanosis. And then we're going to be looking at your flexion and abduction on your hands, your fingers. So I'm going to have you hold them out. And I'm going to press here and don't, resist me. So that's abduction. And then I'm going to have you hold your fist out like that. And I'm going to press down on your wrist. Perfect. Okay. And then we will assess your grip strength. So I'm gonna have you grab my 2 fingers. Perfect. And that's good and strong. And then next, we're gonna be doing the elbow extension. And let's see, I'm gonna have you go ahead and have your arm up, and then I'm gonna try to press down. Good. So that's extension. Perfect. Okay. And then I'm gonna have you do the arm test for the extension and the flexion. So the flexion, we're going to have you raise your arms forward and then up, and then extension back. Perfect. And then we're going to do internal rotation. Or yeah, I guess we'll start with that. Internal rotation. Put your arm up behind you and touch your shoulder blade. Same thing on the others. Okay. And external rotation, hand behind you, like you're brushing your hair. Perfect. Then we're gonna do this finger tapping test, and we're gonna try to touch your fingers rapidly as possible, coordinated. Perfect. Next, we're gonna check your symmetry on your abdomen. So I'm gonna need you to lay down, and we're gonna try to pull this up a little bit. And I'm going to expose this a little bit on our belly. Perfect. To our hip bones here. And it's flat. No lumps, bumps, and there's no discoloration. Next, going to listen to all 4 quadrants and the active vowel sounds throughout. Okay. And then I'm going to percuss. And it's tympanic, it's appropriate. And then I'm going to palpate, light palpation. And I don't feel any lumps or bumps. And the aortic pulse. Appropriate, it's not bound in, I don't feel it right in the center here. Okay, now I'm gonna do a deep palpation. We're checking for the liver under this right rib cage. And it's hard to feel, but it's very, very light and doesn't hurt, right? And I'm gonna feel under both rib cages for the kidneys edges, and that's appropriate. And then the next thing, I'm gonna have you sit up, and I have to feel your back for CVA tenderness. And I'm gonna lift this up, and that up a little bit. And what I do, costovertebral angle, feel it's way up here. And does that hurt at all? Okay, we're tapping that, both sides. Okay, perfect. Thank you. Okay, next we're going to be doing let's see. So I already checked for the your abdomen and your back. Next, we're going to be doing checking your spine, and we're inspecting your spinal processes. I did that before. And it's appropriate, and all the way up, appropriate throughout, and I don't feel any bumps or anything abnormal. And we're going to have you turn around and look at your lower extremities, and your legs look appropriate, symmetry, or warm, dry, no edema. And I'm going to be checking for your popliteal and dorsal pulses, pedal dorsal pulses, and tibial, posterior tibial pulses. And I feel that. And that. Perfect. Okay, next, we're gonna be checking your flexions and extensions in your legs, on your hips. And I'm gonna have you, let's see, press, let's see, I'm gonna have you raise up against my hand, perfect. And I'm gonna press down, okay, and then raise up and press down. Okay, now I'll have you turn over on your tummy, and we're gonna lift your leg up and straighten it up. Your knee, perfect, and I'll press down, but try to resist me. Oop. Okay, good. And then your other leg, and then press down, perfect. I'm gonna have you sit and you turn around. And let's see, I'm gonna have you, inversion for your heel. So you're going to turn your heels in and then eversion out. Perfect. And I think I've done that. Yeah. Your lower extremities, you're going to do the plantar flexion. And that means pushing your toes down. And the dorsiflexion, push up against my hand. Up. Perfect. Up. Okay. And we already did the inversion, eversion. Okay, we're going to do a neurological exam coordination, and that's walking and doing a few other things. So I'm going to have her walk towards me, and I'm going to have you walk the heel toe. Okay, and then when you come back, you can stop there so we can see. And I'm going to have you do, it's a Romberg test, shut your eyes. And we're going to do that for 30 seconds. Okay, a few more seconds. Okay, perfect. Then I'm going to have you open your eyes, and then we're going to do the test where your arms are out front, palms up. That's pronator test. Shut your eyes, and I will press down, try to resist that, and that's for 30 seconds also. Can you stay there for a few seconds, a few more seconds? And okay, I'm going to have you go ahead, open your eyes, and then we'll have you sit. And we're going to do some other tests for the reflexes. Okay, so we're going to do the bicep reflex first. I have to get my little bicep, my little hammer. So we're going to do right arm first, and you just have your arms relaxed, sort of in front. There you go. And you feel the contraction of the bicep. Contraction. And I'm going to do the back, the tricep on the left arm. Perfect. And I feel the contraction. Contraction. Okay. We're going to do knee jerk test. Oh, actually, I'll hold your foot. Okay. And I feel the contraction. And I feel the contraction. Then I'm going to check your ankle jerk test. So feel that dorsiflexion. Okay, perfect. And last thing we're going to do here is we're going to do the sensory test. And this involves different things here. We're going to check soft and sharp right now. So if you shut your eyes, tell me what that feels like.
Soft
And where is that?
on the left cheek. Soft on the right cheek. Soft on the forehead. Soft on the chin.
Okay, and is this soft or sharp?
Sharp.
Okay, and
Sharp on the left cheek.
Okay, and I'm gonna have it do it on your hands as well. You can shut your eyes.
Soft. Sharp.
Okay, next we're gonna do 2-point test. You can tell me if you feel that.
Mhm.
And which hand was that?
The right hand.
And you felt 2 things
Yes.
poking? Okay. And I didn't do the smell test. Can you tell me what that smell is?
Vanilla.
Yes, perfect. And the stereogenesis or stereognosis test, you tell me what that is?
A coin.
Perfect, yeah. And,
A coin.
okay. And then the last thing we'll do is I'm going to do graphesthesia test. Okay. You put your hands out again and shut your eyes. And you can tell me what you feel on your palm.
An 8.
Okay, that's on which hand?
The right hand.
And
A B.
perfect, thank you. And I think that is about it. Do you feel any other, oh, I forgot to ask you. Can you please shut your eyes? So do you feel any other objects touching you right now?
No.
Okay, so that's extinction. Thank you. So we're done. Thank you very much. And I believe that's it. Thank you very much.